Hey, welcome to part 10 of our Medicare sales training course here with the Medicare professors. We got Joey Sarge, Joey the Hitman Sergeant. We got Timmy the Medicare prof, Brownlee. Okay, today we're going to be talking about how do you switch somebody out and why you would always want to do this when the occasion arises. Right, we're going to talk about those occasions as well. When is the time and how do you do it? For me, it's always the time, but it's trying to make sure you get them in the right plan, the right carrier, and make sure you drive the way. You have to know certain disadvantages because plans change every year. We're talking about switching somebody from a Medicare Advantage plan to another Medicare Advantage plan and why you need to do this annually for potential prospects. So Tim, tell us a little bit about why you would want to switch somebody that's on a low premium or no premium Medicare Advantage plan to a different carrier.
It's just simple. Just saw a client that I had the other day. Noticed his co-pays were going up. A lot of his benefits were decreasing.
So let me define this. The client noticed that his copay, the portion of his medical bill that he was paying was going up.
This way.
Yeah, it was going up. And so Brownlee said, hold up. You're on a Medicare Advantage plan. Those prices, we're not going to get them going up. We're going to get them going down.
Exactly.
So tell me about that.
Simple. I showed him the plan, showed him the benefits, answered all of his questions. Typically, they want to know, does this plan provide dental? Does this plan provide vision? My hearing aid is going to be covered. What are my drug deductibles going to be? I outline the plan. I show him everything that needs, answer all of his questions, and all I need from there is his Medicare card. That's it.
$0 premium?
$0 premium 9 times out of 10.
And so you don't mind switching a carrier to a carrier if it's going to lower their copay?
Absolutely. I mean, I wouldn't know how to do it any other way.
And
why to do it.
And so October 15th, December 7th is the time of the year where most people are shopping, but there is actually special occurrences. Actually, you can do it all year round. You can sell Medicare Advantage all year round. So I want to clarify that because it's just during that window of time that there's a flood. Everybody's shopping. That's when people typically are planned and prepped to shop it. You can actually shop it all year round, but people simply they're attuned and aware and ready to go once a year. It's just the way it goes in the industry. Joe, tell us about a story when you switched somebody into a Medicare Advantage from a different carrier and what it did for him.
Yeah.
You were telling me a story. Joe saved somebody, true story, just this last week. Joe saved this lady $6,000 a year. Okay, how does this happen? How does it happen? How do you help an old widow save $6,000 a year? And what does that do for her income? What does it do for her lifestyle? What does it do for her Christmas time? What does it do for her? Because think about this, right? A lady goes from paying $500 a month for a medication that Joe puts her in a different carrier. He does the homework, he does the work, and he changes this woman's life. Dude, $6,000 a year changes a senior's life.
It's huge.
It changes anybody's life.
Yeah, so basically, when I'm looking at these Medicare Advantage plans, copays is a big part of it. And now, the thing about Medicare Advantage that you need to be aware of is there's not just two areas of copays. There's not just doctors and hospitals. There's copays for every day that you're in the hospital. There's copays for outpatient surgeries. There's copays for dental visits. There's copays for prescriptions. There's copays for everything that happens within that policy.
So you're starting to see how it's Medicare that's not to your advantage, right? We want to supplement the weakness of Medicare. We don't want to have an advantage that's really a disadvantage.
I tell people when you get a Medicare Advantage plan, you're saving on the front end and hoping nothing bad happens.
That's why we always, and I mean this permanently, we always offer the hospital indemnity program, which simply is it's an HIP. Indemnity means you can't come against me with something, right? You can't come against me with these major bills.
Right.
We always sell every time a HIP. It's called a HIP, right? And Joe, who do you sell the HIPs through mostly?
Usually through Aetna, actually.
Okay. And again, you just go to the carrier application, select the HIP, and you run a HIP to add to the Medicare Advantage plan, right?
Yep.
Do you do a lot of DVHs, which is dental, vision, hearing? Do you do a lot of DVHs in addition to Medicare Advantage?
There's some plans that come with a decent amount of dental coverage, and there's some that don't. And in those cases, you're going to want to say, hey, you can either add on to those plans. Oftentimes, you can add on like a $30 a month surcharge for extra dental coverage. Or you can write a separate plan for dental, vision, and hearing that covers all three of those.
Now, how do you know, Joe? You work with maybe 5 or 10 carriers. You have 52, but you really specialize in these top 10 that are the best prices.
Right.
How do you know? Like, how do you just know who's changed their plans, who's changed their copays for 2021. How do you know which one is the better advantage? Like, do you have a spreadsheet? Do you have a chart? Have you developed a chart? Do you develop a chart every quarter, every 6 months? How do you know?
There's 2 steps. Number 1, I always assume that I have a better product for the client. I always assume that. And I'm just going to tell them that confidently even before I see what's going on. Number 2.
And why do you assume that?
Because I've got access to every carrier. I've got access, and I'm the one who's actually going to read through this to make sure and do my homework the right way. To see,
because typically as people get older, their plans don't typically get better for them. You know what I mean? Prices don't typically get cheaper as somebody gets older. It's like a roof, right?
Right.
And the older a roof is, it's typically more expensive to insure, right? The older a home is, the more expensive it is. The older a client is, like a life insurance plan. The older a person is, the more unhealthy they are, the worse it is, right? Same thing with a senior. The older they get, the plan. So Joe's sure if they're shopping at the end of the year, or even maybe the beginning of the year, Joe's sure that, hey, I gotta look for the carrier that's cut their cost this year.
Yep. And so what I do is
how do you know?
I actually use that same tool we talked about in one of our first videos, the Insurance Tools Portal. And it's got the Medicare Advantage space where you put in their information, and I ask the client, I say, hey, read off the information of your Medicare Advantage card. And they tell me, oh, it says Humana Gold Choice HMO.
I got a $25 copay for a specialist.
Exactly. And so they're reading off this information. I'm looking for the name. Because if I can find that name, I can look at how that plan is changing for 2021. I pull up 2 different sides. I pull up the Insurance Tools Portal twice. One is going to show their current plan that is going to adjust in 2021, and the other one is an idea. I've got usually 3 that I cycle through. That I think it'll probably be this one, or this one.
Now, if you're like me, what I would be doing is I'd pull out and I'd upload another sheet, and I'd have the list of the top 10 most common Medicare Advantage plans. And I'd probably do this once or twice a quarter or every 6 months, maybe semi-annually. Do once or twice a year, right? And I would list, hey, Humana made this change, United made this change, right? Because I'd want to know the advantages and disadvantages. Joe's done enough to where he just knows instinctively. But I'd want to go run it 5-10 times to where I know.
Do the homework.
Homework. Now we'll help you with that. But Tim, tell us a little bit. How do you know?
October 1st, they release every change to these Medicare Advantage plans.
Is that for the year?
For the year.
So you only have to do it once a year, and our team can help with that, putting together a chart that says, hey, here are the changes that were made October 1st to these plans.
Yep.
Right? So that way you know the pros and the cons. And again, does it ever happen that they're in the best possible plan for the next year? It's so rare. It's almost done. You know what I mean?
Right. And even then, I will be honest with you, there are some people who, by all means and purposes, at first, it looked like they had the best plan. But then I started asking them about what was important to them. And I asked them about the prescriptions. Oh, I have 2 medications and I might take it once every 3 months, right? Or I haven't been to the doctor in 4 years because I eat healthy and I exercise. And I'm looking at this plan, and it would be great for somebody who does need to go to the doctor and does need prescriptions. But there's also another plan that, may not need the same amount of coverage in those areas, but is going to reduce their Part B payment by $10 a month and save them $120 a year. That, in my viewpoint as the specialist, that's going to be a much better option for them because it's actually going to practically help that client in a way that the other plan will not.
And something I want to add on as well, some plans will have a $435 drug deductible, like your client that you mentioned. I had a client that was in a similar bind as well.
$435 a month.
A year.
But this lady's paying $500 a month.
Well, yeah, $500 a month. Your client's paying $500 a month. We had one client that wasn't even bothering with the medication because she couldn't meet that deductible.
Wow.
Luckily, in 2021, there are carriers coming out that do not have that deductible there, where you're only paying your cost share from day one.
Now, do you need a PDP with a Medicare Advantage plan?
100%.
Some of them have it bundled in with it.
That's what I'm saying.
And some of them...
So most of them have a PDP bundled in?
Most of them do.
I wouldn't sell it made without a PDP.
It will say right on it if it does not cover prescriptions. In which case, you would need to write a secondary PDP, prescription
and
drug.
that leads into our next video, which is going to be on PDPs, which we typically call ancillary, which simply means all these extra policies, ancillary products, okay? So we're going to go into session 11, I believe.
Yes.
PDPs.
1-1.
Stay tuned.